So you're a tennis player and your back is hurting. Now there can be many reasons for that. Sometimes it's sometimes it's tennis or exercise, and then you're sitting or lifting in a bad position, and that can create irritation to your back. So there's many different reasons for back pain in a tennis player. What I often find is sometimes the way you're using your forehand or your backhand is where you're using your shoulder or your upper body to move the racket instead of your legs. And that is something that just takes a long time to learn and some training. And so you want to get with your tennis pro to focus on technique to make sure that you're doing that so you're not adding more stress to your back. Here at Performance Therapy Group, we do a mix of assessments to figure out where is your pain coming from. So the first thing we do is rule out any red flags. That's the scary stuff that nobody wants to talk about, but you need to rule out before you start care. So next we do a very thorough neurological evaluation as well as range of motion, movement assessment, and something called McKinsey method, all trying to figure out where are the biggest problems, where are the constraints that are limiting you, causing you pain, and limiting your playing time. So those combined together will give us a pretty clear picture of what's causing your pain. Then we can formulate a diagnosis from there. And once we have a clear diagnosis, we can start the treatment program. Now at Performance Therapy Group, we have figured out that the combination of chiropractic care plus massage therapy and rehab, that combination works the best to help you feel better. So it just depends on what condition you come in with. That decides what type of problem or what type of treatments we will use, because certain treatments work better for different types of low back pain. For instance, if you're having a facet syndrome in your low back, that's when you're jamming your back, sometimes after a serve, sometimes just the way people use their forehand, they're arching their back a lot. That responds best to chiropractic care, as well as using massage therapy and a few different techniques, but that one's really chiropractic. Versus if you're having a disc problem, that's where McKinsey method really is most effective. So it just depends on what your problem is. That will define what treatment we use to help you. If you'd like help feeling better, give us a call or go onto our website and request an appointment.